Good afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, as usual, I'd like to go over a few items. A reminder to place your phone on mute until I invite you to speak or to ask your question, and please do not place the call on hold. Available for questions from the media, we have, disponible pour répondre aux questions des médias, nous accueillons, in Council Chambers, Mayor le Maire Jim Watson, Steve Canalacos, City Manager, Directeur Municipal, Dr. la Dr. Vera Etches, Chief Medical Officer of Health, Médecin-Chef en Santé Publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Phoning in today, we have Councillor Keith Egli, Chair, Ottawa Board of Health, Conseiller municipal et Président du Conseil de santé d'Ottawa, Stephen Willis, General Manager, Planning, Infrastructure and Economic Development, Directeur Général de la Planification de l'Infrastructure et du Développement économique, David White, City Solicitor, Avocat Général, Troy Charter, Director, Transit Operations, Directeur Opération du Transport en commun, Vivi Chi, Director, Transportation Planning, Directeur, Planification des Transports, Pat Scrimger, Director, Transit Customer Systems and Planning, Directeur, Système Client et Planification du Transport en commun. I will now invite each agency alphabetically to ask their question. As usual, you may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. So we will now begin with Alex Gouge at 1310 News.
Hello. So I wanted to ask Mayor Watson about the patios. If, in terms of the patio extension, there's an overhead cost for things like heaters, etc. Do you suspect that there will be a closure for restaurants come winter time because those can't convert to patios or not?
Sorry, Alex, did you get cut off there?
Just at the end a little bit.
Sorry, maybe you just repeat that question, please.
With the patios being extended into the end of the year and into Ottawa winters now, do you think those who are unable to convert for outdoor winter patios will risk closures more so amid the winter now?
Well, what we're trying to do is to give them every fighting chance to survive during the cold weather and when traditional patio season is over. The motion that was brought forward by Councillor El Shantiri and seconded by Councillor Dudas and supported by the chair of the committee, Tim Tierney, gives that option to those restaurants to have that patio season extended. Look, I'm realistic. If it's 30 below, you're not going to be having fine dining experience on a patio outside, that's for sure. But if we happen to get some spells of warmer weather, where people have installed these propane heaters that have direct heat and they're installed safely and properly, then it can expand the shoulder season for people who want to dine outside. It's not the cure-all. I wish we had a climate that was a little more conducive to more than just 3 or 4 or 5 months of patios. But what we're trying to do is at least to waive those fees and allow those restaurants to have a fighting chance of surviving during the challenging times of the colder weather in Ottawa. Thank you.
Thank you.
Do you have a follow-up question, Alex?
No, that's it. Thank you.
Thank you very much. Moving on, we will go to Kate Porter at CBC Ottawa. Kate, are you on mute?
I am on mute. Thank you. This is a question for Steve Willis, I think, just picking up on that point, because if there's only so much the city can do, and, allowing people to have patios in winter is one of them, what other innovative ways could the city be trying to help prop up business once the weather turns?
So we're certainly looking at every option possible, and the Mayor's Economic Partners Task Force involves a lot of members of small businesses, and the Association of BIAs is a key partner there, and they're giving us lots of ideas. I mean, much like we did in the spring before the patios could open and before the businesses open, we'll probably pivot back to a lot more trying to do social media campaigns to encourage people to shop local, buy local, order in. If you can't sit in the patio, you could still order takeout from your favorite restaurants, because what we really want at the end of the day is those places still to be there. And if they can get income from all those of us who have the ability to spend money, that's what's really important. So yes, the toolbox is limited, but as the mayor said, we're trying to give every chance we can with every tool we can provide.
To offer one, Kate, a specific example that was talked about during the council meeting is the removal of snowbanks at a quicker pace than we would normally do in those commercial areas that have curbside pickup options for their customers. You can't have really good curbside pickup if you have a 2-foot snowbank that's blocking the passenger door from opening up. So we're looking at a number of different options like that would make it easier in those commercial districts, whether it's on Wellington Street or Montreal Road or Bank or Elgin or Saint Joseph, to make it as easy as possible for people to come by and do curbside pickup. There aren't a lot of great ideas out there because we're limited, obviously, with our weather. One of the things we have to do is to obviously encourage people to do what they can with gift certificates and cards. We have the Christmas party season and Christmas dinner season that comes up, and we'll have to make sure that people have an opportunity to go and book their office Christmas party at some of these local restaurants inside, obviously, as long as they have the seats and the tables properly distanced according to Ottawa Public Health. So it's going to be, there's no question it's going to be a tough time, but this is the time when we're asking all of our residents, all 1 million plus residents, to go out and support these local businesses in your neighborhood, where you work. I know, a lot of people take their lunch to work and so on, but those who don't, please frequent some of these locally owned businesses to help them out in their time of need.
En français, s'il vous plaît, M. Watson, sur l'importance d'ouvrir les patios.
Mr. Watson, on the importance of keeping the patios open. That's a question for Mayor Watson. Well, it's very, very important for us to support this sector because it's a major challenge for restaurants after terrace season, or patio season rather. That's why we passed Councillor El-Shantiri's motion today to eliminate fees for patios between October and November. It's an opportunity for people here in Ottawa to support local restaurants in their neighbourhoods because it's a major challenge for restaurants. It's very tough for restaurants if they don't have access to patio space during December and January, for example.
Perfect. Thanks for that. My other question is for Dr. Etches. Because I know that you referred to, why Ottawa, and it's kind of hard to hear Premier Ford yesterday call us a hot zone or hot area. I know you mentioned size and the fact that, we opened for phase 3 slightly earlier, but is there anything else? I know that you track, people's movements, or you have, more data points, et cetera. I wondered if there's anything else that you could add to about why we're more of a hot zone lately.
Yes, so what we know is there is community transmission of COVID-19 virus that was happening even as we moved ahead into stage 3. The announcement of stage 3 seems to be an inflection point in when we started to see more people testing positive for the virus and a shift towards younger ages. So we think that as we look at the cases, for example, the study that was presented to council, that it's more on the social behavior side of people gathering with friends and family. We saw that increase. We saw the size of those gatherings increase. And when there's virus out there, it can be in these settings, and then it can spread when there's more people in close contact indoors not wearing masks. So it definitely is about relaxation of the COVID-wise behaviors, of the distancing, the masks, the staying home when you're sick. And what we see is that it will continue to grow unless we push back on that rise in infections with these measures. So now, again, we're the first to go into the schools being open, the first to have this focus now on if you have symptoms, make sure it's not COVID, because you can't bring that into the schools. And so more people will be tested again, and will detect more of what is out there. So, this is to be expected. What we want to do is keep identifying those chains of transmission so we can stop them, but prevent them in the first place with being COVID-wise.
Thank you, everyone.
Thank you, Kate. We will now be going to Ted Raymond at CTV Ottawa.
Hi, good afternoon. My first question is for Dr. Etches. One of your slides today, you had some pretty stark statistics saying that the control measures that we have used in Ottawa so far have prevented an estimated 220,000 cases and 4,400 deaths. Can you explain a bit more about where that estimate comes from, given the disparity between the figures there and what we've seen confirmed so far?
Yes, those figures were for Ontario, for the whole province. And they come from the projections that were made based on the trajectory that we saw in early March with the rise in cases, and the models that have been calibrated to look at our situation. If we followed that trajectory, then we would have got into that territory. Instead, collectively across Ontario, people flattened the curve, and so we didn't get into those higher numbers of cases and deaths.
Okay, well that clarifies things. Thank you. My second question is for Mayor Watson. Given that some jurisdictions are now starting to roll things back or considering them, BC, for example, closing their nightclubs and banquet halls, Mayor John Tory saying he'd cancel trick-or-treating if it's too risky. Is Ottawa looking at any local rollbacks of reopening measures through bylaws or whatever powers in case counts continue to rise? What kind of ability do you have to kind of close things down or move things back a bit in the city?
Yeah, we obviously would take our direction, Ted, from our medical officer of health. If the province comes by with regulations to roll back any of the decisions they've taken, obviously we would adhere to those. I'll refer to Dr. Etches and Steve Kanalakis. To the best of my knowledge, we have no plans to roll back any of the services and operations at this point. Dr. Etches?
That's correct. Based on what I'm seeing, what needs to change is the size of social gatherings indoors. That there's no business, there's no workplace that can make a difference there. That's each of us in our own behavior. So I think that's where we need to target more protective measures.
Thank you very much. Moving on, we will go to Craig Lord at Global News. Oh, sorry, Ted, did you get two questions? My apologies.
I did, thank you.
Okay, perfect. Okay, so Craig Lord at Global News.
Thanks very much. I just had a question for Dr. Etches about school buses and the potential for spread there. I'm wondering, have you been in conversation with any of these school bus operators in Ottawa about measures? I'm thinking maybe like installing seat belts to make sure that kids are abiding by those seat assignments. Have there been any discussions with the operators here to implement measures to help with the tracing and the rule following on buses?
Thank you. So my team members have been talking with the school boards even on the weekend, and then school boards working with transportation authorities to identify measures that would allow us to confirm that students are in their assigned seats on the buses. So there were a lot of thoughts about how that could be accomplished. For instance, with older students that get on earlier, taking a role in confirming that the younger ones are in the appropriate appropriate assigned seats. I mean, we did hear that students can adopt this behavior, that it's just a matter of, you have junior kindergarten students who've never been on a bus before, so it's a new thing to tell them, well, this is your place, and that is expected to be feasible. So I know that those plans are underway.
Okay, and just as a quick follow-up, and correct me if I'm wrong, but I believe the current way that we're tracking institutional outbreaks in places like long-term care homes is anytime there's one case, it becomes an outbreak. But with the schools, it's more two linked cases. And correct me if I have that understanding wrong, but if I do have it right, why the discrepancy there in how we declare an outbreak in a school versus a care home?
Thank you. Of course, with outbreaks, our earliest experience was with long-term care homes and retirement homes, especially long-term care homes where it's a very vulnerable population. We unfortunately have that evidence that the risk of death is very high among that population. And what we saw is that when we were detecting one case in a long-term care home, one person who tested positive, there were often others in the home who also were then going on to test positive later who didn't realize. So we've learned that in that setting, we need to take as much caution as we can, and so to start with all the precautions of an outbreak as soon as we know there's even one person detected. Now that doesn't always mean that transmission has occurred in the homes, and this is our experience now with the homes. We see, in fact, we're identifying one staff person who tests positive, and sometimes it stays at that. There's surveillance testing of all the staff. In an outbreak, when that's declared, with one positive test, we test everybody in the home, and we're not all, sometimes we're finding nothing else. So the practices have changed. There is now routinely improved infection prevention and control so that we're not finding that spread in the homes in the way we did early on. So these are the same as in the school environment right now, people who are testing positive when the exposure's in the community. So an outbreak typically is about transmission in that setting, but we take a more protective approach in long-term care because of the extreme vulnerability of the population. So the school definition of an outbreak is more what you would usually see, that you want to have evidence of transmission at that site before you confirm an outbreak. And so that does mean two people who have tested positive within the 14-day period where it looks like the school was the source of the school environment, not that they were both siblings or they were both, in some after-school program in close contact. There's things we need to investigate to be able to determine where the most likely source of exposure was.
Great, thanks very much.
Thank you very much, Craig. Nous allons maintenant
We'll now move on to Julia Beckett from Le Droit newspaper. Hello, Dr. Etches. I'd like to ask you a question about your presentation this morning. You say that Ottawa is in orange status. What does this mean? Julia, we didn't understand your question very well. We could hardly hear you. Orange level status. Well, okay. Based on our data, we have a color-coded alarm system to describe the situation in Ottawa. And this is based on the data that we have. It shows the situation on the ground. If we're in the red zone, this means that COVID-19 is dangerous. And the healthcare system would be at risk of collapse because the number of cases are going up very quickly. We're not in the red zone. We're at the orange level currently. Why? Well, because we have a situation where we're at risk of seeing an increasing numbers of cases. We are also at orange level for the number of hospitalizations. Now, if we're at the yellow zone, this means that testing is going well, cases are low, and the yellow might send a message to people that you can relax. But that's not currently the situation. We're in the orange zone because people need to be vigilant. People need to continue to exercise physical distancing, wear masks, and try to get our contacts down.
Okay.
I just want to make sure I really understood what you said in English. Well, despite the fact we're at the orange alert level, you're not thinking about closing down any services, because the main source of infection is basically in private homes, right? Is that what you're saying?
No.
Well, no. We'll stay at the orange alert level. We were at the orange level during the summer, and we're staying at the orange level now. And that means that businesses can be open because we've taken steps like requiring social distancing and requiring people to wear masks. All that protects us against a major spike in the number of cases of COVID-19 at the community level. As I explained earlier, it's really social settings that are causing problem. It's contact with our families, our friends. That's the real source of transmission here in Ottawa. Closing down businesses would do nothing to resolve that issue. Thank you. Thanks, Julia.
To John Willing at the Ottawa Citizen.
Hi, everyone. A question for the mayor. Mayor, I know I see you've been going around the city talking to businesses, visiting different wards. And I know we talk a lot about restaurants and the health of restaurants, but what other businesses do you think will be on the ropes during the fall and winter months because of the COVID precautions?
Well, obviously, you think of places like banquet halls that have limitations, the wedding business, party planners, these people that put events together for conferences and so on. The overall tourism and hospitality industry, you think of tourism as restaurants as part of the hospitality industry, but also those businesses that have attractions, the number of days, for instance, the museums were closed and they're not still fully operational or open. You think of the taxi industry, people are not traveling as much, they're working from home. Those are some of the ones that I have the most concern with. They probably fall under the jurisdiction of tourism, hospitality, and hosting services. Places, I go by places in Westboro like, barber shops and the Lululemon store and other appliance stores and so on. Those are still going to I believe, survive. They may have a tougher time surviving, but people still need to buy clothes and groceries and shoes and so on. The other areas, people have the choice. They can eat at home or they can go to a restaurant, and it's often more expensive to eat at a restaurant. So those are the areas that I have concern with, and some areas we can help out as much as possible through the restaurants and the patios. Other businesses, I was talking with a gentleman who owns a very successful operation in rural Ottawa, a banquet facility and maple sugar operation, and he's very concerned because he can only now have in his hall that fits 450 people. and you can't dance closely and you can't sing. Well, that's part of the fun of weddings. So, people are postponing or canceling their weddings, and that has a direct impact on his bottom line in terms of his banquet hall, the catering component to his business. Thank you.
Thank you, Mayor. As a follow-up, I wonder if the city is talking with your friends at the federal government and the Heritage Canada and the NCC about winter activities and what the status of those are going to be, such as the Rideau Canal Skateway. I'm thinking Winterlude, even at a municipal level, the Rink of Dreams at City Hall, Lansdowne skating surface. Are these things going to be open or happening over the winter?
Yeah, that's a good question, John. Our plan is to continue to work with Heritage Canada, which is responsible for Winterlude. I think obviously if people socially distance, as the canal is the longest skating surface in the world, so there's lots of place to socially distance and to line up, and respect those social distance rules when you're going to get a beaver tail or rent your skates or so on. My hope is that program will still continue. We'll still be able to do the Rink of Dreams, but it will have to be monitored in the Rink of Dreams that there are fewer people on the rink at any one time. But with respect to the canal, it's wide enough and long enough that I believe that there wouldn't be a serious risk. People are bundled up. Most would have helmets or scarves on, and my hope is that we're able to continue that tradition, not only because it's a fun tradition, it's an important economic generator for our tourism sector as well. So, I'm sure Heritage Canada at some point will be approaching our medical officer of health to seek her advice and guidance, but at this point, my understanding is that planning still continues to move forward for that important winter carnival. I don't know if you wanted to... Okay, thank you.
Thank you very much. Nous allons maintenant passer à Jérôme.
Jérôme Bergeron, Radio-Canada. My question's for Mayor Watson. Over the past few days in BC and Quebec have both decided to tighten measures on bars and restaurants. Is this something that might be replicated here in Ottawa if we continue to see a rising number of cases? Well, for the time being, Jérôme, it's not something we're considering. It's not an option for us. But at the end of the day, of course, that's provincial jurisdiction. It's up to them to actually issue directives on that. But for the time being, the status quo will continue to hold for bars and restaurants, but it's important really for us to continue to convince restaurant and bar owners to make sure that people respect social distancing and they make sure that people do wear masks in their establishments. Now, for the time being, we're continuing to ask owners to respect these rules. It's in their best interest because if we see a major hike in cases, it's quite possible that the province or the chief medical officer might recommend that these establishments be shut again. Thank you very much. Second question, Ms. Etches. Now, on the orange alarm level, like in Quebec, is the alarm level actually linked to the possible steps you will take, or is it really just a way of measuring how you're able to deal with a hike in cases? Answer, thanks for the question. Well, I'll explain now the measures and the steps that are linked to each of the four colours. There are four parts to the Ontario reopening plan, safe reopening plan even. Now, the first part of the plan is based on the number of confirmed cases and community spread as well. And the second part is the capacity of the healthcare system, what's happening in hospitals, basically. The third dimension is the capacity of health, or public health rather, to actually deal with contact tracing, etc. We currently have that capacity. And the fourth dimension concerns our capacity, our testing capacity, basically. Currently, we have a capacity to get results for most people within 48 hours. So we're not at the red level yet. But the number of cases is going up, so we can't be at the yellow level. It's a risk for vulnerable populations. So we need to continue to be vigilant and to continue to take the steps that we know work well to control the spread of COVID-19 in the population. Thank you. Thank you, Jérôme.
Sue, are you there? Okay, so this is all the time that we have. C'est tout le temps que nous disposons aujourd'hui. Thank you very much, everyone. Have a great day. Bonne journée à tous.